guest, a doctor, a public health leader, an administrator, and as I hear, a pretty decent badminton player too. Joining us today is Dr. Meghal Shah, the State Program Officer at Daman, who has been at the forefront of healthcare management, digital health initiatives, and major national health programs. From leading COVID-19 responses to improving public health policies, and now an MBBS student here at IIPHG. He has done it all. Dr. Meghal, welcome to Swasthya. We are thrilled to have you here.
Thank you, Geetika. It's my pleasure and an honor, and again an honor to be part of this institute.
So my first question to you is, you are a doctor, a researcher, a public health officer, and a badminton player. Tell us, do you even sleep? Or is caffeine your secret fuel?
Well, Geetika, my day starts with double espresso, but that's not what keeps me going throughout the day. When you are working in government department, you are always constantly firefighting, you are adapting, and there's something always new that will be thrown at you. And that's what drives you on your toes. And again, the passion to drive a meaningful change, that's what keeps you awake throughout the day. And coffee does not help there. It is the challenge of public health. And I would like to clear one thing about badminton. I told you I'm a pretty decent player. I am a semi-professional player, but badminton is my religion. So no compromises there. It's for my mind, body and soul. Keeps me active, keeps me fit, and I can fight stress with that.
Yeah, we have all seen you play and we agree with you. You went from an MBBS student to managing major public health programs. If your journey were a college assignment, what would it be? A last-minute group project, a well-researched thesis, or a surprise viva you forgot about?
I would say neither of those three. It was a viva that I didn't know it was there in the curriculum. So after my MBBS, I joined the government of Daman as a medical officer. And there my journey started with clinical postings, so purely hospital experience and only dealing with patients. After 7 years, one fine day, out of nowhere I get the order that now you are the State Program Officer for Communicable Diseases. And that's how it usually is. So I didn't sign up for public health, and initially it was not an easy job to understand the nuances of it. And because it's not taught in MBBS, so you never know what's going to come out and what you need to do to deliver in public health. But with time, I learned, I adapted, and I rose up to the responsibility. And finally, I understood what it requires to convert policy into action. With intersectoral coordination and support, you can really drive public health policy into action.
That was a great answer and very insightful. You have handled COVID-19 responses, digital health initiatives, and food safety. Which of these you found the most headaches? And which one made you go, this is why I do this?
If you consider headaches, you will have headaches every day in public health. But you have to find solutions of those headaches. I would not really rather term anything as headache, because those are obstacles, challenges thrown at you, and you find solutions that you get over it, and you find an appropriate response to the challenge that is thrown at you. So COVID-19 threw all of us into a very deep and dark valley. Not easy to come out of it, but it brought something very special out of me. I could still think clearly under a lot of pressure, and there used to be something new coming up every day, some new challenge, because initially we didn't have a roadmap. What are we supposed to do? What is government supposed to do? But then things started to fall in place, and it would not have been possible without intersectoral support and coordination. It's a very important lesson for public health, that nothing can be done alone. So you need support from multiple departments, multiple people. I'll cite you one example from our district. With every thing in place, and we had set a special challenge for us when it came to COVID vaccination. So we had decided that we're going to vaccinate maximum number of people in a single day, and we could vaccinate almost 10% of the eligible population in a single day. So that was a beautiful example of how chaos is turned into coordination, and that's what I live for in public health.
That was great to hear about your personal experiences. Public health can be overwhelming. What's one thing you wish someone had told you when you started?
There are a couple of things I wish someone had told me before I started my journey in public health administration. The first is that all battles cannot be won at the same time, and maybe few battles cannot be won at all. So that is the reality of public health. You have to choose your battles, decide your priorities, and you go for the interventions which are backed by evidence the most, which have the most impact. So that's how you strategize in public health. Because it's a war with so many battles. It's never ending. If you succeed with some disease, there will be another that will pop up. So we are struggling with non-communicable disease right now after the struggle with communicable diseases. Secondly, you need a lot of patience, consistency and perseverance to see any meaningful change. So because when you are new, you go very aggressively, right? That I'll make the change, I can make it happen. The energy is good, but you have to preserve that energy to go for long. And thirdly, the most important thing, if someone had told me to do my MBBS only, because this course has opened my eyes to ask questions, the right questions. What is the evidence behind whatever we are doing in public health? Because usually in government systems, when you go directly, you don't ask questions. You directly follow what policy is, because it's the national guideline. But it is very important to ask questions even for policy. And it's very important to ask what is the evidence behind whatever intervention or whatever actions we are doing in public health. Because evidence-backed actions only can drive meaningful and sustainable change. So those are the few things I wished I knew earlier. I would have contributed to more change to public health.
I also think that pursuing public health was a good decision for all of us because we are getting so many answers. Many MBA students dream of working in health administration. What's the expectation versus reality?
So all the positions in public health are up for grabs.
Are they?
Yes, they are. They are. So you absolutely have to believe sky's the limit. But it depends on what skills you honor and how you show your resilience and adaptability to whatever environment you are thrown into working. And but the journey is not very glamorous to begin with. तो अगर सब लोग को ऐसा लग रहा है कि हम पॉलिसी मेकिंग सीख रहे हैं, रिसर्च सीख रहे हैं, तो कल जाके सीधा प्रेजेंटेशंस बनाएंगे, मिनिस्ट्री को प्रेजेंट करेंगे, सिर्फ डेटा एनालिसिस करेंगे, वो सब नहीं होना है. Sorry to say. And it should not happen like that because you cannot directly start making policies until you have a connect to the ground about how things happen, how the current policies are either being successful or failing, and what is the ground reality about it. So most of us who graduate from here will start from the field level. So, and that's how I believe that's how it should be. Understand how a policy is translating into action, what community feels about whatever health interventions we have chosen for them. And then from there, you can start your journey towards actual policy making. Since you know now how things happen, how health functionaries work, how community health works, and what community needs. So, but yes, that's the truth also that any position, whatever is available, and it's an upcoming field. So it has got more importance after COVID. At least people know what is public health after COVID. I think before that, very few people knew what public health is. So there will be more and more positions about public health. Since all the diseases now that we are facing are more on preventive aspect of it rather than treating, because now we are dealing with chronic diseases. So good luck to all of us.
Thank you, Dr. Meghal Shah, for giving us a reality check. Let's say you get a magic wand and that lets you instantly fix one public health issue in India. What's the first thing you do?
I'm sorry to break your heart. There are no magic wands in public health. But let's assume within a hypothesis that we have a magic wand and the only dream that I have in Indian context for public health is that we stop thinking vertically about the primary healthcare. We have to move towards universal health coverage. I believe to achieve that we need to integrate all the current vertical programs. There are so many programs and so many different interventions under that programs. It's very difficult at the field level, if you see the reality, for our staff to actually deliver these services under all those programs, because programs have kept on increasing exponentially wherein staff has not. So I would like to see all that programs merged horizontally under the umbrella of comprehensive primary healthcare. I think that's how we can realize our dream of universal health coverage and health for all, which is our sustainable development goal. And secondly, in order to do this, we need to use the potential Ayushman Bharat digital mission has, because without technology and digitization, I think it is impossible to have an idea about all the determinants, all the distribution of our diseases. So we need a lot of integrations. Maybe we need a single portal for public health. That's my dream. If I had a magic wand, that's what I would do.
So we reject the null hypothesis. So this is my final question to you. What are the top 3 skills that MPH grads should master to survive in public health?
Top 3?
Yes.
I would say first is develop the flexibility to work in any environment. Yeah. You might be working at PHC on one given day. Secondly, you might be presenting to the ministry in Delhi. Both of those tasks require very different aspects to me. So develop the adaptability, and the more you adapt, the more impactful your work will be, and you'll be surviving for long in public health. You'll have a good profession. Secondly, nothing in public health can be achieved single-handedly. So you always need a lot of support, you need a team, and you need support from other departments, community, everyone. That is, I would say, the biggest challenge to garner support. So develop your people and communication skills along with your presentation skills, so that you can put your ideas very clearly, and you can easily develop trust and garner maximum support for your actions. Thirdly, and which is I think the most important now, with the advent of digital revolution that we are seeing these days, because it is becoming a very powerful tool and it is here to stay. And going further, it's going to be more powerful, which can drive our actions in a meaningful way. Because I think data can drive policy better rather than anything else. So we need to get all our skill sets, everything behind understanding these digital technologies, whether it is Excel, whether it is PowerPoint, whether it is data analytics, or whether it's AI. And we will see in near future about applications of AI in public health. So let's prepare ourselves for what's coming for, and let's make ourselves sustainable for the future. So my final words would be, let's stay grounded and let's stay curious.
That was very insightful. And that's a wrap on today's episode of Swasthivani. A huge thank you to Dr. Meghal Shah for sharing his incredible insights, experiences and a few laughs with us.
It's been my pleasure to be here with you all guys.
For all the public health enthusiasts listening, remember, finding your path in public health is a journey, not a one-size-fits-all formula. Keep exploring, stay curious, and who knows, you might just be the next leader transforming healthcare. If you enjoyed this episode, don't forget to subscribe, share, and stay tuned for more engaging conversations. Until next time, stay healthy, stay informed, and keep making a difference. See you in the next episode.